Now, for more on the one-year fight of COVID-19 in Nigeria, we're now joined live from Abuja by the chairman of the Presidential Task Force on COVID-19, Mr. Boss Mustafa. You're welcome to the News at 10.
Thank you, Ayo. It's a pleasure being on the news today.
All right, how would you assess the fight against COVID-19 in Nigeria 1 year after the virus was detected in the country?
Well, I want to start my comments with expressing on behalf of the President and the people of Nigeria our deepest sympathies to the families of 1,902 persons that have lost their lives as a result of the COVID-19 infection, and also to congratulate hundreds of thousands of those that have been infected and have survived, part of the members of my household, and to commend the frontline workers, particularly for their resilience, their commitment, putting themselves in the first line, on the front line to save people and to save the nation. So I think we've done very well in our national response. Our national response was robust. And you understand that the PTF was set up with a 6-month mandate, particularly to coordinate a multi-sectoral approach, to mobilize resources, and to ensure that the non-pharmaceutical interventions that were put in place were enforced so that we can tame and stop community transmission. And I think by and large, we've succeeded in doing that in the last 1 year. And in doing that, one of the first things that we did was to put a coordinating machinery that was functional, and to also ensure that we had a response that elicited the support of the public sector, the private sector. And I can say without any fear of contradiction that never in the history of Nigeria have we ever experienced such a robust response, bearing in mind that when I was appointed on a one-page letter with all the members of the Presidential Task Force listed, without any definite terms of reference. So it was a Herculean task, but the intellect, the abilities of members of the task force, plus the purposeful leadership that we got from Mr. President, we were able to craft a national response that I can say by and large, most of the things that we did 6 months ago is what the entire world is copying today, especially in the areas of testing and the regiment of restrictions of movement. We've done very, very well in that. We were one of the first countries that put in place a need for a PCR test, either on outbound flight or inbound flight. So, it's after about 6 months, most countries are copying that now. So I can say by and large, our response has been successful. We've done incredibly well. There are still things that needed to be done, and we will try to make sure that going forward, we work assiduously to ensure that the health infrastructure in this country, which was exposed as a result of the pandemic, is repaired and fixed and recalibrated so that future pandemics will be dealt with more appropriately. I believe that we will leave a handbook for the next generation to work with. I didn't receive any handbook of previous epidemics or pandemics, but I believe that we will leave a handbook that will be very helpful to fight future pandemics.
All right, let's talk about testing now. In spite of efforts by the PTF to ensure that it's carried out vigorously in many parts of the country, it does appear a lot still need to be done. What steps are being taken as we speak to ensure improvement in this regard? Have you found out why the figures keep rising, apart from the issues of inadequate testing?
Well, in the areas of testing, I can tell you, Ayo, we've done tremendously well. We might not have tested more people, as much people as we would have wanted. Our initial projection was that within a period of few months, we should be able to test at least 2 million people. Right now, after about a year, we've tested just 1.5 million. But I can tell you that when we started, even the infrastructure for testing was not available. We started with basically with a population of 200 million people. We had only 4 testing sites. the national lab here in Gudu, that is owned by NCDC. We had LUT in Lagos. We had the Redeemers University in Ede, and the infectious hospital in Irua in Edo State. Those are the only 4 molecular testing laboratories we had in this country. Today, I can report to you with every element of confidence that we've ramped up. We currently have 122 PCR laboratories spread all over the 36 states and the Federal Capital Territory. So that's a big improvement in terms of building our infrastructure for testing. The issues that have militated against testing, one is this idea of COVID-19 is for the rich, is for the urban dwellers. Those people that are resident in the rural areas have no need for testing. But we've developed a new strategy where we will be able to ramp up our testing, because it is very, very important. If you do not test, you will not find. And if you do not find, you will not be able to isolate the people so that they do not continue on the spread of community transmission. Right now, there is a program that is being driven by the Nigerian Center for Disease Control in respect of testing. 450 persons by each local government across the span of the 36 states with the Federal Capital Territory. By the time we achieve that, the number of tests would have increased tremendously. So I believe we will continue doing that in terms of ramping up our testing and ensuring that those that are infected are isolated as we eagerly anticipate the arrival of our vaccines.
All right. Yes, we definitely are keeping tabs on that one as well, the arrival of vaccines. But a quick one again, just wanted to get your mind back to the issue of the testing. The rising figures, why do you think that this is still happening, apart from the issues of inadequate testing? Or have you found out why the figures keep rising?
Well, the figures have been fluctuating. Right now, as a matter of fact, our figures have come down substantially. In the last couple of weeks, immediately after the Christmas celebrations and the New Year celebrations, we had warned sufficiently that the figures would rise, because during the times of festivities, Nigerians have a tendency of throwing caution to the winds. And that happened, and we saw the effect of that as the figures kept rising to 1,000 plus continually for a couple of weeks. But you can see that relatively the figures have started coming down. The last night's figure were within the region of about 500, which is relatively low compared to what we experienced in the past. And I believe that it is in the nature of the virus itself. We're still studying the characteristics of COVID-19, its mutation, new variants coming up. So there's still a lot of work that needs to be done as to the understanding of the infectious and prevalent nature of COVID-19. In other countries, as a matter of fact, after they had tamed COVID-19, after the first and second wave, some countries like New Zealand, who have been adjudged to have been very successful in their handling of COVID-19, are beginning to experience new surges, and there are lockdowns of major areas and provinces of the country. So I believe that we will continue to experience these up and downs in terms of figures, because the complete nature of COVID-19 virus has not been established yet.
Mr. Boss Mustafa, Chairman of the Presidential Task Force on COVID-19, we do appreciate your thoughts on the news at 10. Thank you once again.
Thank you.